What is your name?
Celine Mendonca
Coming from?
from Canada. I come here to Goa for 4 months.
So what is your problem?
I had carpal tunnel syndrome and I've had it since about 3 or 4 years, which started slowly, where my hands, my palms would get cramps during the night and would be very severe, would not be able to sleep at nights. Difficult to do things or hold anything for too long due to the cramps. The hand would just get numb and then I'd have to move my whatever I was doing to the other hand. When I went to the doctors there, I did all the tests and all, and the doctor said that the option there is surgery because it's a pinched nerve, and but before we do a surgery, because the surgery is not 100% guarantee that this is going to be rectified, because it recurs, it can recur any time. But for the nights, they asked me to use braces like these. These are called splints, which one has to put it to the hand to sleep, and they are very effective because it keeps your hand straight so that the blood flows through and you're able to sleep. But you have to have them every night, which becomes a problem because sometimes you travel, sometimes you do. If you have forgotten to take it, you're going to be in trouble. So when I was in Goa this time, I have seen this Sai clinic every time I pass by in the car. Never thought of going in there, but something happened, and this time when I was just about to leave, I had about 25 days left over, and it just struck me, and I said, let me go and have a look and see what kind of a remedy there is. So I came and I met Dr. Prabhu, who seemed to be very good when he spoke to me. I was very comfortable with him when I spoke to him, and he immediately told me that it was a carpal tunnel syndrome and he could rectify it 100%. What else did I need? I just wanted it rectified without any medication, without any side effects, and I was a bit hesitant because of the needles, but it is much better than having to go through the pain that you have to go through otherwise. So I agreed to come and do it. He told me I'd have to go through 80 treatments, but I had no time. I had only 20 days, and he said I can do it within 20 days, but you'll have to come here 4 times a day, to which I agreed. And today, in fact, the first day that I came here and I did my treatment, I said, let me try if I can sleep without the braces, and bingo, I could sleep without the braces. That was the day I stopped using my splints. Until today I have not used them.
How many years you are using this?
About a year or so, about 2 years, since I've been using it, and I now do not need to use it.
If you are not using, can you tell me, because people don't know what is carpal tunnel syndrome. So can you explain me what is carpal tunnel syndrome and how you are suffering, actual suffering?
Well, carpal tunnel syndrome is basically this part of the hand, the palm gets cramps, and the cramps are not the usual cramps. These are more like pins and needles that
very severe
kind of prick into your palms. And if you were to sit like this, you can only sit for a few minutes, and then your hands would get cramps. Then you'd have to bring it down. If I were driving, my hands would start getting numb, and then I'd have to do this to my hands so that the blood would flow and circulate, and then I'd be able to hold the steering. So this is
for a few minutes again you must hold, again you must do the
then I'll move it to the next hand or something. So this has been my regular thing. Like, I love to go in the water where I kayak and I go in the boat. But when I go kayaking, I have to be very careful because it's the manual oaring, and I have to change you cannot do it with one hand, you have to use both your hands, so it becomes difficult. Now that I've gone through this treatment, I'm going to go back and try kayaking for a while, for a longer time than I ever did, to make sure that I don't get these cramps anymore. And
cramps are more at night?
The cramps are more at night because in the night you can't sleep then when you have cramps. But during the day, if you have cramps, you just wring your hand and make it kind of, this blood circulates, you go back to it. And you do whatever you have to do, but sometimes things fall out of your hands because they're numb. And in my mother's case, her fingers have already bent now. She
They're
cannot
not
do
right.
anything with the hand because she also had carpal tunnel, but it was detected too late. She never used to tell anything that was happening to her. By the time she told us, it was very late, and she is very old. She's like she's 88 years old. So now there's nothing that we can do, and I don't know if she would like to come and try with Dr. Prabhu.
Yeah.
I'm not sure. If
Where
you
she
can
is?
help.
In
She's
Canada?
in Canada, yeah.
Okay. So at night it becomes too much, and mostly
Yes.
when you're sleeping like this in position.
Especially if I put my hand above my head and sleep, then my hands are very, very numb. Then there's no blood circulation. I cannot sleep because I can feel that my hands have no movement in it.
Because
sensation.
one who suffers from carpal tunnel syndrome knows what is numbness and what is cramps.
Exactly.
Because
It
they
is
are unbearable cramps.
correct.
Yeah,
And
you
it is-
cannot sleep
Right.
full night. You must suffer with
Yes.
that.
I
That-
did that for a long time, and then the doctor gave me a solution, and I went on to the internet and I found out that it was better to put these splints rather than having surgery. So many people resorted to putting splints because at least they could sleep at night. During the day they can do, somehow they can manage doing things, but at night was the most important part.
So as per the carpal tunnel syndrome is concerned, there is no treatment even in Chinese acupuncture. And also as the surgery is concerned, also there is no guarantee that your things will
Correct.
get cured. Plus if it damage, then you may lose your hands.
Yes, that's
So there's fear is there.
That is
So a
correct.
lot of people avoid this going
That
for
is
surgery.
right.
Even doctor says go with the life like this if you can go,
Correct.
bear it instead of going for surgery.
That's true.
But because of that, lot of people started coming to us and asking for the results. Then I started doing research on that, and we got very good results. Most of the carpal tunnel syndrome patients are like doctors or dentists. They come for a particular problem where they have holding hand and all like that. It becomes more problematic. We had 2 patients from Germany where after operation they were totally stuck with the hand.
Oh.
So other hand they tried with our acupuncture and we treated them. So one which is operated they got failed, and what is not operated we rectified that problem. So the same way I have taken, but we required actually time for giving this treatment. But you had a very short period and we done special treatment. Almost lot of my research point I use.
Correct.
And within day, you just tell me when you started your improvement after
The
how many days?
first day,
From first day.
the first day itself, there were no cramps in my hand at night at all. And the next day, I was in the garden watering my plants, and I was holding the hose for about 1 hour, and I had no problem. So like if I had to in a regular situation, I would not have been able to hold the hose for more than 10-15 minutes because then I would have to move my hand.
And after every 5 minutes you
Move it
must
from-
change.
Yes, I would have to change hands. And the results have been instant basically. They've been from the day one. After the first treatment, the results have been, I would say 100%. But then
What
I
about
had to go through
splints? Everybody use in your country there?
Yes, everybody who has carpal tunnel is advised. If they're not advised, they go on the internet, and that is the best solution. It has been advised that to use splints.
Now my advice for you, that see we got treatment that is 100% curable. Whatever cases you are taken are totally cured. Most of the patients who are from abroad, they come even for 10 days we tried, which are just not so chronic disorders, but they got fresh cases. Within 5-10 days or so they have improved. Improved, totally cured. And one of the patients we recorded recently who came from abroad, after 6 years he came to meet me. And he told me, doctor, I am totally fit. Have you recognized me? Doctor, I was coming for this problem and I came for the conference here. And just in that conference time, within 5 days you have treated me. Till today I am totally fit. So that is how we got lot of results like that. But as per the recording is concerned, we never thought, I think so 1 or 2 might be the recordings. But we never thought of doing recording. So because this is actually really serious problem. Condition is very serious. One who suffers knows what is suffering of carpal tunnel. You cannot see it. if you
You
can
can't
show me
see it.
hand,
No.
nothing
No,
is
nothing. The hand
defective,
is
nothing
normal.
defect can be seen.
Hand is normal.
If somebody
Yes.
see that, we will say, hey, what is the problem?
It's
He says,
within, it's
are you
inside.
lying or like that?
Correct.
But because all patients were telling me, doctor, nobody can see my pain, that much I am suffering.
Yes.
So in anyhow, we have treated you, you are happy. I might just inform you that can you do something about if you got Facebook or internet, then you just put your write-ups on that, let people know you
I
got
will.
100. Yeah.
I
And
will do that.
within short period also, within 10, because see now at your condition, within day you stopped using splint. So within 10 days we have done lot, it may be.
Right.
And within 20 days, if they come for 20 days, we can manage to totally fit and fine.
Right.
Okay, so that is the best treatment which we can, if they come for 1 month tour or in Goa, then we can manage them to treat
Sure.
such cases.
But
Okay?
I would recommend not only for carpal tunnel.
Yeah.
I think that you can do a lot of other
Yeah,
things.
yeah.
And I have seen a lot of people here. My own testimony is that I have been shocked by some of the people that have come in here who are unable to walk. Within 3 days, I've seen them walk out, which means it's amazing.
Yeah, one case we have taken, that is paraplegia.
Exactly.
He was 5 years on the bed.
Correct.
I was not
Exactly.
ready to take the case, but with
Yes.
the long needle therapy and special treatment what we have done, he told me within the 3 days, everybody has seen me, he was lifted inside first.
Yes.
And after 3 days he was started walking. So sometimes
Yes.
patient get dramatic result.
Yes.
If your body responds and your faith
True,
is there,
right.
it works very good.
Yes. I
Okay.
suggest that anybody who wants to come here should come here with a positive mind.
Yeah, important is
with an
positive
open
mind.
and put entire faith in Dr. Prabhu, who is excellent.
Thank
and
you.
the best, I think, in I don't know about the whole of Asia, I have not seen, but I think he's the best.
Because we are handling the cases even from the China, a lot of people from America also, or in England and all, who have taken Chinese doctors treatment. But for carpal tunnel and slip disc and all, they take long time, but there is no cure, they feel. But here people do everything normal life. And whenever you are coming next time, we will do again recording.
We will.
To show after so many years after how you are.
Definitely.
Because we started recording now in that way.
Right.
We have our patient who are coming to meeting me now after 10 years, 20 years and all. We started doing their recording because some of the people has got mentality, this is acupuncture is just temporary relief or something.
Correct.
It is not
Correct.
temporary relief. It is a permanent cure. So all the cases which you are treated for years together, they are totally fit and fine.
Right.
So we are trying to record. So next time when you are in India back, so just don't forget you
I
come
will
inside.
definitely come here and
Yeah.
say hello to you and tell
Okay.
you the progress and what I've been able to do with my hands
Yeah.
after this.
Okay, thank you very
Okay,
much.
you're welcome.
Yeah.